All right, good afternoon, everyone, and apologies for the delay in starting this afternoon's webinar. I'm Emma Cook, the Director of the Star Rating section within the Department of Health and Aged Care, and I have the responsibility for the development and implementation of star ratings for residential aged care, as well as the National Aged Care Mandatory Quality Indicator Program. I'm joined by my colleague here, Alicia Hodgson, who is the Director of the Transparency and Risk Profiling section. Alicia is responsible for the implementation and management of consumer experience interview policy, as well as a range of other reforms. So before we begin, I'd like to acknowledge the traditional owners and custodians of the many lands on which we meet today and pay my respects to elders past, present and emerging. I'm attending here today from Ngunnawal and Ngambri country. And I extend this acknowledgement and pay my respects to First Nations peoples joining us for the webinar. Thank you to everyone who's made the time to join us for today's Consumer Experience Interview webinar. We're really pleased to be presenting to you all. And in today's session, we're planning to cover a brief overview of the star ratings and how consumer experience interviews will feed into these. The purpose of the interviews and why engaging with older Australians about their care and services is so critical. The methodology being used to undertake these interviews and the importance of participation in consumer experience interviews. If you have any questions during the presentation, please feel free to submit these using the text box available. So jumping straight into star ratings. The star ratings are a linchpin reform that aim to empower older Australians and their representatives to make informed decisions about their care. By way of background, many of you will be aware that the Royal Commission highlighted that aged care quality should be defined, delivered and capable of being measured, and that current data about the aged care system is fragmented and incomplete, resulting in a lack of information about service quality to inform consumer choice, as well as to support provider improvement and government's own improvements at a system level. The Royal Commission highlighted the need for a philosophical shift, placing older Australians at the centre of the aged care system. And crucial to this is hearing the experience of older Australians in order to ensure that the system is relevant and appropriate for the people it's intended to support. In response, and consistent with recommendation 24 of the Royal Commission, government committed to the publication of star ratings for residential aged care services by the end of 2022. The star ratings will be published as an overall rating and based on 4 subcategories: service compliance ratings, which are based on the regulatory activity of the Aged Care Quality Safety Commission; consumer experience interviews based on a sample of at least 10% of all care recipients at services collected by a third-party workforce; quality indicators across 5 crucial areas of care currently captured under the National Aged Care Mandatory Quality Indicator Program, or the QI program, as I might refer from now. And these include pressure injuries, physical restraint, unplanned weight loss, falls and major injury and medication management. And finally, staff minutes derived from the quarterly financial reporting and new ANAC classifications. The delivery of star ratings really builds upon previous work and current reporting on My Aged Care, particularly that across the existing service compliance rating dots, the consumer experience information on My Aged Care, and the quality indicators displayed on the AHW's website at national, state and territory levels. So in terms of the development of star ratings, the proposed design has been produced through a rigorous process of research, which really looked at similar international aged care rating systems and star rating systems, written and face-to-face consultations with a particular focus on the views of older Australians and their representatives. And then the consultation findings were translated into fundamental star rating design elements and algorithms that were used to produce a working prototype that could ingest test data, run algorithms and publish star ratings in a way that replicates what we would do on My Aged Care. We then put that prototype to older Australians and their representatives and went through many, many weeks of testing, 5 weeks initially, and then it's continued from there in order to refine and test the model and come up with something really robust and that meant that accurately displayed information and really meant something for consumers. So the findings from this process, as I said, developed those fundamental design aspects. So if we dive into those quickly, some of these include, and these are just the proposed, this is where we landed on, a scale of what 1 to 5 star represents. So that 1 star would represent well below average, 2 stars would be below average, 3 stars average, 4 stars being above average, and 5 stars being well above average. It really emphasised that consumer experience was viewed as the most important aspect of the star ratings, both by providers and older Australians and their representatives. And as a result, the weighting that was determined for that was 33%. So this is the biggest aspect of the star rating system, followed by service compliance ratings at 30%, care minutes at 22%, and quality indicators at 15%. Star ratings were proposed to follow a rules-based system to the extent possible, so making it really clear as to what specifications needed to be met to attain a certain rating. So an example of this might be with non-reporting of quality indicators or non-reporting of data for care minutes, or not enabling participation in consumer experience interviews, that the rule that is proposed to apply is that a 1 star rating is awarded for that relevant subcategory. So I have to stress, I suppose, that there's an overall rating and then there's the subcategory. You would get a 1 star for the subcategory, not necessarily for the overall. Now, also importantly, it was heard that the ratings need to refresh frequently, and we will encompass that through near real-time updates for regulatory information, also service compliance rating changes, quarterly updates of quality indicator and care minute data. And please note, I think it's really pertinent to highlight that the first iteration of star ratings in December would therefore include data for this July to September period. So July to September collection of quality indicator and care minute information that's submitted from October will be the data for those subcategories that is published through the December star ratings. And of course, for consumer experience interviews, the data will be included on an annual basis. We heard that the display of historic information is really important, and important both to providers and older Australians to show the performance of services over time, including demonstrating improvement in services. A provider preview of star ratings is understood to be really important, and we're working to allow providers to review their ratings prior to publication, so that you can notify us of any IT or technical errors should you detect these, but also so that you can prepare and you can have that visibility before the public does. There's also other rules. As I mentioned, there's a couple of rules, and we do try to have a rules-based system, so it's really clear. Another rule is around new services, and that new services would get data only as it becomes available. So we wouldn't seek to give them kind of a preliminary or a holding rating. We'll wait until there's data there. But as I said, they're the fundamental design aspects that have been developed through the process that we've stepped through just a moment ago, and they're all proposed and they all remain subject to ministerial agreement. And so we'll be seeking ministerial agreement to star rating design, and once received, the department will communicate this to the sector and continue to support stakeholders up to the implementation of star ratings by the end of 2022. So I trust that this brief overview has been helpful and provided some useful context to support our further discussion on consumer experience interviews. And for that, I will now pass to my colleague Alicia to provide more information.
Great. Thanks, Emma. If we could switch to the next slide, that'd be great. So as Emma said, this consumer experience interviews at the moment is proposed to contribute 33% of the overall star rating for residential care services. Why is this? Well, because it puts the consumer voice into the centre of the system, as we said, was a recommendation of the Royal Commission, and it ensures it's relevant and appropriate for the people that it's designed to support. Without these, also, how can we actually say that we're delivering person-centred care? If we go back to the Royal Commission in this vein, it highlighted that we need to reinstate consumer experience interviews. So that was recommendation 94. Which were formally undertaken and published by the Aged Care Quality and Safety Commission between 2017 and 2019. So these reports, for information, are still available on the Aged Care Quality website. So consultation feedback did indicate that older Australians might not feel comfortable with providing honest reflections to a regulatory workforce. So that's why we've now engaged with a third-party workforce to do this. So through the consortium, we've engaged IQVIA, in partnership with Access Care Network Australia and Health Consult. And the consortium is currently and has been scheduling visits and are aiming to interview around 20% of older Australian residents by 31 October 2022. Across residential services, depending on the size, no less than 10% of older people will be interviewed. So while the 20% goal aligns with the Royal Commission recommendation, the statisticians have also told us that the sample size will enable us to gain a really appropriate insights for all aged care residents, which includes some of the minority populations and the more diverse populations. Next slide, please. So we'll talk a little bit about what the CEIs are and the methodology. So the CEIs are interviews with older Australians residing in a residential aged care home, or in some cases with their representatives. These interviews will inform an annual consumer experience report for each service that provides the facilities with an aggregated response for each question based on the collected survey results. And these are the outcomes that will contribute to a service's star rating, as Emma highlighted before. As a part of the methodology for the consumer experience interviews, the consortium is using a simple set of questions which are intended to prompt the lived experience of older Australians who are residing in the aged care homes. So there's currently 14 questions which range from all the way from do you like the food here to do you feel at home here? And the list of questions is available on the department's website. The questions include 12 like-it scale questions, which allow the consumers to provide short answer responses with options to give statements, and 2 free text questions, which are really designed to empower residents to further elaborate on their experience of care in the facility that they're residing in. The interview questions were previously developed by the Aged Care Quality and Safety Commission with the help of La Trobe University's Lincoln Centre for Research on Ageing. And now I want to talk a little bit about the methodology. So how do we develop it and what is it? In developing the methodology, the department consulted with dementia advocates to confirm if residents with cognitive impairment should be part of the consumer experience interviews. And dementia advocates strongly encourage that older Australians with cognitive impairment do need to have a voice and the opportunity to provide feedback to shape the care they receive. Excuse me. The approach and methodology to interviewing residents has been developed to meet and to be consistent with global best practice on quantitative research, ensuring that it is both inclusive and sensitive to the needs of residents. So this includes ensuring the interviewers are trained to engage with older Australians from diverse backgrounds and diverse challenges in an appropriate manner. The methodology also includes the following key aspects. So aged care homes are contacted ahead of time and are given the opportunity to provide insights on the status of their residents. Homes can also raise any concerns about the capacity of a resident to engage and can nominate a representative to provide support on the day of the visit, if that's deemed necessary. Before the interview actually begins, interviewers will seek consent from older Australians participating. So this consent is really critical, and it can be withdrawn at any time during or after the interview. Where there's evidence that an older Australian doesn't have the capacity to undertake the interview, for example, if they're unable to respond or to effectively engage in conversation and the questioning, then the interview won't continue. Either the older Australian or the interviewer at any time can choose to stop the interview, and the responses that are collected won't be included in the consumer experience report. So while the primary aim is to gather feedback directly from older Australians residing in aged care homes, there are instances where a resident is unable or unwilling to speak for themselves. And in this instance, the interview can be completed by a proxy. The consumer experience interview sets out a pretty strict criteria for proxies though, and on the type of people that can be interviewed as a proxy. Proxy interviews are requested initially only from formally appointed representatives, which the resident has registered with My Aged Care. These formal representatives have authority to act on behalf of the residents and have the same power to make care-related decisions as the residents themselves. Prior to being interviewed as a proxy for a resident though, the representative will be asked if they are the best person to represent the voice of the resident. If they're not, if they identify that perhaps there's someone closer or with more knowledge of the resident's lived experience, then a different representative may be contacted to act as a proxy. This process helps to ensure that the opinion of the proxy most closely reflects the experience of the resident. And while the interviewers will always aim to speak to residents directly, it is important that in the absence of that, a representative is able to act on their behalf. Next slide, please. Participation in the consumer experience interviews is critical, and I really want to highlight this. Non-participation will mean that the consumer experience component of a service's star rating will be unavailable, and the overall star rating will be negatively impacted. Non-participation will lead to a low score, but might be the result of two instances really: declining to participate. So in this case, services are well within their right to decline, but the facility will be removed from the list and no further contact will be made, or recurring cancellations or rescheduling of visits that demonstrates a potential pattern of avoidance. I do want to be clear though, we absolutely understand that aged care homes may need to reschedule a visit or cancel an initial visit to conduct the interviews due to COVID-19, influenza outbreak, or other unforeseen circumstances. We will always prioritise the safety of older Australians, so that's absolutely okay. However, we do receive COVID-19 outbreak reports, and we are aware that some aged care homes are cancelling and rescheduling visits due to COVID-19, where there are no reports of COVID from that facility. In general, though, we have seen excellent participation, and I do want to thank the sector for their support with this really important initiative and being responsive to the requests from the consortium in ensuring that interviews are scheduled and completed in a timely manner. Next slide, please. I just want to take a moment here to talk about the feedback and a bit of the progress. So far, 19,620 older people have been able to have their say, and that covers around nearly 1,400 residential services, so 1,391. To date, we've received positive feedback from older Australians and homes about the consumer experience interviews process. So I thought I'd just take the liberty of mentioning a couple. In several instances, we've had interviewers receive feedback from the facility management and the staff stating that they really welcomed the process, specifically saying that we're referring to the fact that if they don't know, they really can't improve. So that's excellent to hear. We also had last week an interviewer from ACNA visited an elderly man who was non-verbal and required assistance from a family member. The resident and their family member was really excited to see that ACNA provides a response guide which consists of a rating scale and is supported by smiley faces. The resident wore a laser pointer headband to help communicate their answers. So our interviewer was the first non-family member to be able to communicate with this resident. And our interviewer advised that they were so grateful that the process was so inclusive and was involving their family member. So I did just want to take a moment to share some of the good news stories that we've seen so far. Next slide, please. So, in conclusion, the consortium are scheduling more visits each week. It is important that all aged care homes have their visits scheduled as soon as possible, as the last day to schedule a visit is 16 September 2022. So, not too long, that's just a couple of weeks away. Our consortium partners have been really flexible with visits being scheduled over 3 times for a number of services. However, the onus is really now on services to have these done in time for the star ratings. The department is currently planning a second round of interviews to collect updated information with older Australians for next year. And we'll notify all aged care stakeholders once we confirm the details. So that's about it. I'll throw back to Emma for questions.
Perfect. Thanks, Alicia. And I can see a few starting to come through. So I'll try and group them up a little bit by theme. So where we've had a few kind of converging on a similar topic,
Yeah.
I might just conflate them into a single question. I can see some coming in around, are consumers without capacity being interviewed? So I think you've spoken a little bit to that,
Yeah.
Alicia, but if you want to go into that further?
Yeah, sure. So no is the answer. While the CEIs or the interviews are looking to include all older Australians, and they are conducted on the premise that older Australians have the capacity to engage. The interview methodology, as I talked about in depth, really does seek to determine that people are both able to and are willing to engage in them. So participants or their nominated proxy must be willing and able to provide that consent that I spoke about. So where that criteria is not met, the interview does not proceed. And that may be at the entry point where the discussion is occurring between the interviewer and the resident. It may be during, if the resident is unable to complete the interview. And it could be at the end if they wish to, withdraw their consent as well. So.
Perfect. Makes sense. Some more are in around what is the impact on aged care services to help facilitate interviewers?
Oh, okay.
That's
So
one specific one that I'm reading there. So
yeah,
apologies.
so that's around, I guess, the effort that facilities needed. Yeah. So we have tried to make the interview process as simple as possible. So ACNA take quite a few steps in engaging with facilities prior to the actual interviews occurring. So they'll contact facilities or homes, to schedule a visit. They'll look to confirm the resident information, explain the program in depth, so that facilities really understand what's actually going to occur and what the impact is. And at that point, they'll look to address any of the concerns that homes are looking. What that's designed to do is on the day really reduce the impact. Everyone sort of knows what the plan is. So services might be asked to support interviewers in gaining access to the facility, and depending on the size and the configuration, also to navigate around the facility. But staff are not they don't participate in the interview process and don't need to be present. So I hope that answers your question.
Perfect. There are some questions coming in, and you've addressed this in part, but I think people are just wanting to clarify whether an aged care home can cancel a scheduled visit.
Yes. So they absolutely can. And I do want to reiterate, we understand the impact that COVID-19 has had and continues to have on facilities, and that's a very legitimate reason that you need to reschedule. And that, of course, extends to other infectious outbreaks. So yes, you can cancel. We are just seeing a pattern in a very small amount of services that may have multiple cancellations, potentially referencing COVID. Where there isn't really evidence to suggest they have COVID. So I guess in summary, rescheduling is completely fine. At this point, if you are cancelling a visit, the onus really is on the aged care facility or home to make sure that they're rescheduled in time to be able to contribute into the star ratings.
Super. Right, so sooner rather than later is...
Yes, yeah, very soon, please.
Alrighty, so Can an aged care home dispute an outcome?
So no, and the reason is because can't really dispute a consumer's experience, if that makes sense. So once the interviews are concluded, a consumer experience report will be shared with the participating aged care homes, and I think we touched on that before, to provide useful data and identify areas for improvement. And it also allows you to take action on any of the outcomes you see coming through. The CER rating, along with the star ratings for the other subcategories, will be available for provider preview on the portal prior to being published on the My Aged Care website. So if you genuinely believe that there is an error or a mistake after you've viewed the preview, then you can report that error to the department. And we will engage with IQVIA to investigate if there's a mistake, sort of, perhaps in the data source or in the IT system that reflects the rating.
And I can probably add from a star rating side on that one, we'll communicate more once we get ministerial agreement, but we will likely provide you with a phone number in order to get in touch and confirm if there's any issues or concerns arising from those provider previews across the board, not just consumer experience. So certainly more to come on that as well. So we have, let me see, how often, and we've got a few converging around this one, but how often will the department run consumer experience interviews?
Look, at this stage, we're looking to do them annually. So as Emma had mentioned with the star ratings data, they'll be run every year. So we are planning for the next year's run of interviews at the moment.
Perfect. And I had a couple of others that were similar, just clarifying whether it would be done 3 monthly, but I trust the answer is the same.
No.
Yeah, once a year. Then we have, this one's a little bit more of a tricky one, but why there is no risk adjustment to the results to account for cognitive diversity?
Yeah, okay. So I touched on cognitive impairment and our engagement earlier with dementia advocates specifically. There is always the presumption of the capacity to engage. As we know, there's a huge amount of diversity when it comes to things like dementia. So consumer experience is a frequently used tool in many healthcare settings. It's not typically risk adjusted. So these tools are designed to measure a person's view of their own experience of a setting or a service or an experience that they have, and it's not related to their level of health or their cognitive diversity. So in our consultations, we've highlighted that there's no intent at this stage to risk adjust.
All right, I think that clarifies that one. All right, this one probably crosses both of our sections, but I'm going to throw it to you for a response anyway, Alicia. So will you be making the interview results available to the public and aged care homes for ongoing improvement?
So yeah, I sort of touched on that prior. Yes, we will, but it's once all the interviews are conducted. And then there'll be that 2-week period as well where providers can preview it. Is that?
Yep.
Yeah.
Yeah. Alrighty, and I might question myself on this one, so I can see. I can see a question coming in for me, which again probably crosses both, but asking if consumer experience is really central, why it is only given a 33% or 1/3 of the rating. So I guess my response to that would be that we followed quite a rigorous process to determine what those weightings were in terms of priority for the overall. So each subcategory has its own, or is proposed to have its own 1 to 5 star scale, so that older people and their representatives can look at the piece of information that is most important to them. And that might be one area more than another. It might be staffing, or it might be more clinical care, so that they can look at those. And then when it feeds into the overall rating, obviously this is where it becomes they have to be prioritised, assuming that they're not all equal. So we went to older people and their representatives, and we asked about the maturity versus the importance of each of the 4 domains that are feeding in. And while consumer experience was the most important, older people and their representatives still felt that compliance, that staffing, and that quality outcome measures were also very important. And so it was through that process that we determined the weightings that we got, and it was informed by the people that will be using it. So that's how we landed on 33. They're all really important aspects. They were all recommended by the Royal Commission under recommendation 24, and consumer experience was the most important. Alrighty, let me just have a scroll through. It's getting tricky now because I've got to scroll through and see which ones I may have missed or have come in new. Someone has said, can we still, or a couple of people actually are asking, can they still book? Apologies if we've already answered. But they just wanted to clarify, can they still book, and maybe any guidance on the steps that can be taken?
Yes, so absolutely you can book up until the 16th of September, although hopefully sooner, so that we've got enough time for the interviews to be conducted. If you go to the IQVIA Consortium website, the directions and contact details are all there.
Perfect. Alrighty, and then how long does it take? So I think this was a follow-up question when you were talking about the individual services getting the information back to support improvement.
Yeah.
They're wondering, how long does it take to get the report, and is it sent directly to the home? So I'm assuming that people know that there's the provider preview and that they'll see their information, which is proposed to be made available to them in December through the Star Rating provider preview. But beyond that, I think people are wanting to clarify whether they're going to get a report and whether they might get it directly where they could.
So yes, so reports will be sent to providers. It'll be once all the interviews are conducted. Yeah.
Alrighty.
Oh yeah, so we've just got one here around multi-purpose services included. So at this stage, it's just residential aged care facilities, so multi-purpose services not in this round. However, we will and are currently reviewing what next year's interviews look like.
Perfect. I think that's all clear, and we're certainly seeing a slowdown on many of the questions. I cannot see any news, so I might give it another moment or two. But otherwise,
So I think we can also provide, yeah, that's right.
yeah, I was going to say the next steps, I think, are if there's any questions, so if whether we've inadvertently missed yours, or whether you think of something after this as you're working through the process, the email address for the Consumer Experience Interview Policy team at the department is ACER, ACCER, @health.gov.au. And so ACCER @health.gov.au, and you can send an email directly to the team with anything that you might need to know, and they can get a response back to you following on from this webinar. So you'll also see on the next slide, there's a website address, and that's somewhere that that's the department's website, and you can go onto there to find out a little bit more information, or some other context as well, often as a useful first step, because a lot of the basic information that you'll need to know will be contained up there. Alrighty, so many thanks to everyone again. We've gone through pretty quickly and ahead of schedule, but covered a lot of ground, and certainly appreciate everyone's time this afternoon to run through the consumer experience interviews and the star ratings. We trust that this provided a really useful overview and context around consumer consumer experience interviews, the process, the importance and the relevance to star ratings. And we look forward to communicating with you more as we get closer to the end of the year.
Thank
Thanks,
you.
everyone.